Well, welcome to the Young Dementia Network's webinar on social care and financial impact of young onset dementia. I'm Tessa Guttridge, I'm chair of the Young Dementia Network, and I'd like to introduce you to our panelists and welcome them too. So introducing you to Catherine Quinn, who's Associate Professor, Centre of Applied Dementia Studies at Bradford, and Elaine Daniels and her husband, who Elaine cares for her husband who's living with young onset dementia. Joining us later will be Gareth Hislop, and we'll introduce him when he joins us. I'm going to just add a little disclaimer that we're not offering official financial advice here, where the panelists are not claiming to be experts in the rights and wrongs of financial actions, so please do bear that in mind. So, reminder to all of you that you're not on video and you're not on mic, but we would love you to use the chat function as much as possible, and do add your questions to the Q&A box and add them during the session so that we have a good understanding of the number of questions and try and get through as many as possible. So Catherine, Elaine and Gareth, when he joins us, are going to be ready to respond to your questions. But first of all, we're going to start with a conversation between Elaine and Helen about Elaine's experience of the financial impact of young onset dementia. Catherine could start that. Thank you.
Well, thank you, Elaine, for agreeing to talk to us about the financial impact of living with young onset dementia. Now, you care for your husband, Lawrence, who lives with young onset dementia. Can you tell us a bit about your experiences of navigating that area? For instance, when did you first feel the impact financially?
I think we felt the financial impact before Lawrence's diagnosis more than after the diagnosis. He lost his job in 2017, and it was 4.5 years later that he was actually diagnosed. So he was 56 when he lost his job. And for that period of time, he was treated for anxiety and depression. So all of a sudden, we went from 2 incomes, and the larger of the 2 incomes suddenly wasn't there. So this to me was the hardest part, because one, you didn't know what was happening to Lawrence, because it didn't feel just like anxiety and depression to me, although I didn't know what it was. You know, I was phoning the doctors and saying he's crossing the road without looking, he can't tell the time, and giving them all these sort of functions that he wasn't able to do, but they never sent him for any tests. They just continued with tablets. So I've always worked in finance for a long time, so I just pulled our home budget apart for the last 12 months and then just rebuilt it to fit the income that was coming in. And obviously it takes a time to turn something like that round, to cancel everything and live differently. But I just felt so grateful that we didn't have a mortgage, we didn't have dependent children, and I'm watching families who are not in that kind of fortunate position. So that was the hardest part financially for us.
And that was all before Lawrence's diagnosis? Oh,
yes, yeah. He tried to get a job. He tried to be a care worker, but he couldn't find addresses. He couldn't open the key safes. He tried to be work in a warehouse, but they said he wasn't quick enough. So as time was going on, and he was changing in certain things, it became more obvious to me that he wasn't going to be able to work again. So I went and studied. I got myself on a course to get a better job. Luckily enough, I was able to. So I changed my job so that it paid a lot more. It was far more stressful, but it just felt that was the only option for us to do.
So the motivation for that was because you were stepping up to try and provide more.
Yeah. I was trying to bridge a gap.
Yes.
And also it was an unknown.
Yes.
Everything is so unknown. So that was the hardest financial time for us. because once he was diagnosed, it was a relief to me, because I felt as if I knew what I was dealing with. So then I was able then to see what was available, what support was available. And again, I felt myself lucky in the fact that I was still relatively young and I was used to finding out things. So I was able to find out all the benefits and grants or whatever there was available, and just applied for them.
Yeah. So going back to you saying your background was in finance, that was really helpful to
Yes,
you.
it was.
Yeah,
It
from
was.
a point of view of budgeting.
Absolutely.
Yeah.
I love it, which is a bit sad, but I suppose it kind of makes me tick. And so that bit was a little bit of home turf.
Yeah.
That was the kind of easy bit for me. But you know, it's an unknown journey.
Yeah.
I think that's the thing about this. And it's moving all the time. It's changing all the time. I'm finding now, although, okay, you've hit to a point where you think you're stable, but as his condition changes and his needs are becoming different, you're still exploring what the sort of rules of the game are. You know, what you're entitled to, what you're not entitled to, how much is reliant on your own savings. And the other big part that I've discovered is that areas are very different from each other. Local authorities have totally different ways of funding and supporting, and it really is a postcode lottery.
Yeah. So have you had any help in sort of navigating that, finding out how to apply for things and what is appropriate to apply for?
Yeah, in our circumstance, it was a long time before we got any support. And that was because Lawrence was so young. He was falling between elderly care and younger care, and he fell between the two. And so it took 9 months for them to get in touch with us. So by that time, I'd actually found what there was. I just sort of managed to navigate my way. But then, since then, you meet different people, and you learn a lot from other carers. That's definitely true. Sort of practical, perhaps, tips you learn from other carers. But also, I found a local lady who works for our carers group, and she's just amazing at filling in these forms. So whenever I find anyone who needs help in filling in these forms, I point them to this lady called Ruth, who's amazing. You just find out as you go. It's very much it's just a journey. And that's the way I see it. And it's a journey that is changing all the time. And you just have to adapt and just try not to look too far ahead, because what happens to some people isn't necessarily going to happen to you, and vice versa. It's very much an individual journey. Yeah.
So you mentioned about taking on a role that paid more.
Yes.
And can you tell me a bit more how that evolved? You mentioned about things changing.
Well, I managed to keep the job for 2.5 years. I loved it. I can't say that I didn't, because I really did. It really pushed me, and I learned an awful lot. But at the same time, I was spinning the plate of home, and just that unknown of what was happening to Lawrence. And in the end, I came to a point where I couldn't manage anymore. I had to give the job up. But the time of it just worked. It got us through a period of time. And then I gave that job up, and then Lawrence's condition then changed again. And then, although I took on a job that I could work from home and was much less hours, I couldn't manage that, because however you try to spin the plates, your focus is on sort of the greater need, if you know what I mean.
So how should things be, Elaine, what would you like to see within social care, within the support for managing the financial impact?
Well, initially, that first diagnosis is so crucial in terms of finance. It would you'd be getting support 4.5 years earlier, but not just that. It wasn't just, money's a huge part. It makes the world go round, obviously, but it's that support of knowing that where to go, where you can go for help. And even now, I'm finding that I'm still searching for where to get the help at this particular stage. And you do find it. You just keep searching. Our local hospice is an amazing resource. Our carers support in my area, they're lovely. They're there for you. It's finding what you need, finding where the support is, and also finding groups that work for the person. Lawrence is a certain character, and so some groups wouldn't be right for him. But because he's always spent his life mad about music, the Singing for Dementia just works for him. And so it's finding the right place that fits that right person at that right time. We used to go to another group, which was fine when we first started out, but as his condition changed, that wasn't the right place for him. And so this is where the journey evolves and the journey moves. And as far as your finance, you hit a point where you've got whatever there is. It's not massive, but once you've hit that point, then it's a case of managing yourself, managing your own income and expenditure, and just getting on with life as best you can.
Yes, and balancing those costs of care with your priorities.
Oh, well, absolutely. Yes. Yeah. That again is where you come into your postcode lottery, I'm afraid. But it is what it is. You don't want to be bitter about it. You just have to just find your own way. Yeah.
Well, thank you very much, Elaine. We really do appreciate it. Thank you for talking to us.
Always so useful to really listen to the to lived experience, the reality of living with young onset dementia and all the impacts that it has, and finance being such a critical one. We are welcoming Gareth now. Thank you for joining us, Gareth. Gareth and Elaine will be part of the panel who will respond to the question and answers, or will be offering the answers, I should say, to the questions, which I hope you're going to put into the box. Meantime, though, if I could suggest that Elaine and Gareth turn off their cameras, if possible, and then we'll leave Catherine to present the findings. Thank you very much. Thank you.
Is it going to let me? Okay. So today I'm going to be talking to you about the financial impact of young onset dementia, as I say, and trying to really raise awareness of the issue. I'm going to be talking about the Dynamic project, which is the project that we've been undertaking. I'm going to talk you through the evidence base that we've been collecting throughout the project, which highlights the financial impact of young onset dementia. I'll then talk to you about some resources that we've been developing as part of the project. And then right at the very end, you're going to see one of the resources that we've created. So, as you've heard from Elaine's presentation, the financial impact of young onset dementia affects many aspects of individuals' lives. It was a really, really great talk there from Elaine, really highlighting some of the core issues that people face. And when I was preparing for this webinar, I was very much taken by a quote from one of the people who took part in the interviews that I'll talk about later on, that talks about the fact that you can't really prepare for the impact until you actually speak to someone. And this really highlights the importance of being confronted with the realities of people's experiences, as we've done right at the start of this webinar. So just to start this webinar, I just want to take a moment for you all to reflect upon Elaine's video and for you all to think about what if something happened in your lives that affected your income, your expenditure, your ability to work. This could be through illness, through changes in circumstances, could also be through work-related issues. So, perhaps facing, the threat of redundancy. If this happened, what aspects of your lives would be affected? What would you do? Where would you seek help? Because the reality is that young onset dementia occurs at a stage of life when people generally aren't expecting these types of financial changes. I think from a young working age, financially, we are set up to prepare for older age. We pay into pension pots. Most of us take out mortgages that we expect to pay off before we retire. I think we also tend to have expectations of reduced income as we get older because we know we're going to be living off pensions, and we try and make up savings for older age as well. But what if something happens that impacts on your income and finances when you're younger? And this is why it's so important that people with young onset dementia and the supporters can find and access appropriate support. And today, what we're going to be doing really is highlighting some of the issues that people face and what is the financial impact and what challenges are people facing. When preparing for this webinar, I reflected upon the fact that although I've worked in dementia research for quite some time now, financial issues hasn't really been the forefront of the research that I've undertaken. I've tended to focus on other areas, but I was reminded of a project that I have been involved in for quite some time, which was the IDEAL study. So this was a large-scale study exploring changes in people's ability to live well with dementia. Now, this study focused on all aspects of dementia, so it wasn't just focusing on young onset dementia. But it was asking questions around living well. And one of the questions we asked people was, what does it mean to live well to you? And we had responses from just over 1,339 people with dementia on this question. And I've listed the responses here. These are the main topics that people were talking about. And you can see right near the top that people were talking about the importance of having security. And within this, predominantly, what people were talking about was having financial security. So having money and no financial problems. They talked about having money to pay the mortgage and bills, being able to live comfortably, having enough money to, to have to pay for the house and the car, having money, not just, not having lots, but just having enough to live comfortably. People reflecting on the fact that they were in situations where they didn't have a house, they didn't have the mortgage to pay, and not being in a position where they couldn't lead the lifestyle that they're leading now. So very much, living well with dementia very much encompasses having that financial security. I'm now going to move on to talk about the Dynamic project. So this was a study that right from its onset, what we were focusing on was, thinking about how we could improve social care for people with young onset dementia and their family supporters. So at the start of this project, we were not specifically focusing on financial issues. I will talk you through how, through the course of the study, this ended up being one of the areas that we actually focused on. But to begin with, we identified that the social care provision for people with young onset dementia may not be at its best because it may not be sort of focusing on the specific needs and issues faced by people with young onset dementia and their supporters. And as you can see at the bottom, this study was funded by the NIHR. So the project to begin with had some main core aims. We wanted to understand the social care needs, experiences, and preferences of people living with young onset dementia and their families. We wanted to establish levels of awareness, knowledge, and practice amongst professionals in social care. And we also wanted to produce recommendations and resources to improve social care for people with young onset dementia and their family members. And if you're interested in learning a lot more about the study, you can see that I'll put a link at the bottom there. You can see the paper that we've written that shares the protocol. So as you can see from the project aims, we had broad aims about trying to collate information about what was currently available in terms of current provision, and to think about how we might be able to come up with suggestions or solutions about how might things be improved. And we wanted to do this through a process of looking at the information we were collecting and working with individuals to identify core priority areas that we should focus on. And as I talk you through the findings of the study, I'm just going to be focusing purely on the bits of information that we collected on that specifically related to financial issues. There was a lot of other information we collected as part of this study, but for the nature of this webinar, I'll just focus on the information we collected around financial issues. So in order to get to where we are right now, which is around developing resources, we had a process of collecting information and bringing all that information together to explore the findings. So as I'll talk you through, we did some qualitative interviews with people with young onset dementia and their supporters, and we also did a survey that we ran in England with professionals. We brought all that information together and we started to identify key priority areas. Now I'm going to talk you through this process as I go through the webinar, so I'm not going to focus on it too much now, but it's highlighting how we got to the bit where we identified that, finance was a kind of a core area that we should be focusing on. So in terms of the interviews that we conducted, so we had 33 people taking part, and some of the interviews were conducted singularly, some interviews were conducted with people together. And these were interviews with people with young onset dementia and their main supporters. And we talked to them about a variety of issues, but today I'm just going to be focusing on what came up around the financial impact. And these are just some of the quotes that I came across. And a lot of these issues are going to come up repeatedly in the webinar because these are very common issues that came up. And these are also things that obviously reflect some of Elaine's experiences as well. So obviously one of the main financial impacts that came up was around people losing their job. So you've got a quote here from a carer talking about the fact that the person with young onset dementia hasn't worked for at least 12 months and they've not been able to hold down a job. But it doesn't just affect the person himself, it also affects the family supporter, because here you've got someone talking about the fact that they couldn't cope with working and looking after the person at the same time. So they had to hand in their retirement notice. They didn't really want to, and they were sad about that. But the financial impact, as Elaine talked about, it isn't just about impacts on income. It also relates to the fact that there are new expenditures. This is a quote from an individual that's talking about paying for care for the person. So obviously this was somebody in a situation where they had savings over the threshold to receive state-funded care. And they're talking about essentially liquidating the whole pension pot to use that money to pay for that person's care so that they can have paid carers coming in, until eventually you got to the situation where the savings went below the threshold and then the state will step in. And as I'm sure everybody's read, the private care, is expensive. It's a lot of money to pay for. But there was also additional costs that came up. So, talks about especially the travel. So this is thinking about things such as, having to travel to appointments, to travel to attend support groups, etc. And particularly travel costs may increase if a person can't drive anymore and they're having to use things such as taxis. And lastly, as Elaine was picking up as well around this kind of the lack of support. And this is somebody reflecting on their experiences of being diagnosed both with cancer, but also diagnosed with dementia. And quite interestingly, I was at a conference yesterday where this issue came up again. And it's about the fact that when they got diagnosed with dementia, they felt they got a lot more support. The first thing they do is to go through your finances. But on dementia side, nobody mentions this. So very much feeling like they weren't getting the support there from the dementia side of things around finances. So we'd collected information directly from people living with young onset dementia and the main supporters, but we also wanted to understand the social care provision from the perspective of professionals. We created a short survey for staff with a role in or awareness of adult social care planning, provision or management or commissioning in England. The reason why we focused on England is obviously because the social care provision differs across the UK. And so we specifically wanted to look at the context in England here. And our aim was to better understand the provision. We kept the survey really short because we're working with, busy professionals. And so we didn't want something that was going to take them a long time to complete. We had a lot of help with circulating the survey, and we had responses from 39 people. If you want to see the full paper about the survey findings, I've put the information there, and I'm sure we can share this after the webinar. Here today, I'm just going to focus on a few of the findings. The respondents to the survey were people commonly working in local authorities, mental health trusts, or third sector organisations. As before, I'm just going to be starting to pull out the findings that specifically related to finances. But I did think it was quite interesting that we asked people about what situations trigger referrals for social care assessment for people with young onset dementia or the families. And predominantly what responses that came through indicated that referrals were made in times of crisis or safeguarding. So very much reactive to situations, rather than in some respects being preventative, that help was being called in because there were crises, there were situations that needed help. We asked about what types of care needs trigger referrals, and very commonly what came up was concerns about the carer. So situations where maybe there's going to be a breakdown of care, or where the carer isn't coping. So very much that seemed to be the pathway. And picking up through the responses, what came through was that there were issues around finances that came up that was needed, triggered referrals. So as illustrated in the quote from the previous slide, we've got people talking about, when finances are stretched and funding private support is no longer an option. So, the idea that, as Elaine talked before about the fact that it's a journey, things change over time. People's needs change over time. And the need for paid for care can also change. You can also see a situation where a person living with dementia has concerns about supporting the family, unable to work as long as prior to a diagnosis. So again, an issue coming up again around the person not being able to work. I just thought I would also just share, some of the things that came up, because we asked people about how could access to social care for people with young onset dementia be improved? Where could things be done a bit better? And the answers came up around better awareness of young onset dementia and young onset dementia services. So there's need for better awareness, the need for better commissioning and care pathways for people with young onset dementia and their families. This need for support in navigating all these different pathways. The need for better community support, so thinking about support that's specifically targeted to people with young onset dementia. But also thinking about the fact that, the condition doesn't affect one person, it affects the whole family unit, and the need for better support for carers and the wider family. With young onset dementia, they also may have, people that they're looking after at the same time. You've got, young children, for example. So I've talked you through the information we were collecting. So we conducted those interviews and we conducted that survey. We then took the information from those two different parts of the study together. We brought it together and we started to look at what commonalities were coming through. What were people talking about? What were the common issues? As I said at the start, the aim of the study was to identify priority areas to work on. Within the scope of the study, we couldn't look at everything, but we wanted to identify priority areas. So I'll now talk you through what we did in terms of doing a prioritization exercise with stakeholders to identify those priority areas, to review the existing knowledge and evidence based on these topic areas. So to think about the evidence, but also to think about good practice in these areas, and then how we work through this process to co-produce the resources that we're going to share with you at the end of this webinar. So the first thing that we did was to do a stakeholder workshop with 30 stakeholders who identified that financial issues were a key theme that we needed to work on. So this was a workshop, so as you can see at the bottom of this chart, it was building on that evidence that we'd collected through conducting interviews and from conducting a survey. And we conducted some analysis to bring together that information to identify 6 priority areas, and that one of these key areas was financial issues. I'm now going to talk you through how we co-produced the resources that we developed. So we'd identified that finance was one of the key priority areas that we wanted to work upon. And the first thing we wanted to do was to identify and think about what was the evidence on this topic area. And so the first thing we did was to look at the research evidence base and to see what research has been conducted on the financial impact of young onset dementia. What do we already know? And actually what we found was there's quite a lot of research articles written on this topic, not purely focusing on this topic, but it very, very commonly came up on research articles about young onset dementia. It was a very common topic that came up. And as you'll see, when you look at some of the core things that came out, these are things that we've come up before on this webinar in terms of what people were talking about. So firstly, there was the impact on the income of the person with young onset dementia. So this was around the loss of job. So the person losing the job. And although we have, things in place such as reasonable adjustments, and we have support that people can access around things such as, access to work, etc. As Elaine was talking about, that a diagnosis may take some time, and it may be that the person loses the job before they actually get a diagnosis of dementia. We also saw in the evidence base that there may be impact on the income of the carer. So this happened in 2 ways. One is that a carer may have to reduce their working hours because they felt that they were no longer able to work and be in a situation where they could leave the person at home. So they may find they have to just stop working completely. But we also found the other situation where, as Elaine mentioned, where you go from having 2 incomes to perhaps having 1. And it may be that the person who has to take on the caring role has to increase their work or actually take on a job because they're now the sole wage earner for that family. We identified things around unexpected changes in household income. So this is about the fact that, you've got things that they may have been committed to, financial commitments, so mortgages that they weren't they've got a mortgage and they weren't expecting these financial changes. They may have credit card bills to pay. These are all unexpected changes. They weren't planned for. There were also things such as increased household costs. You've seen from the evidence I've been talking about before, such as the costs of having to pay for care, the costs of having to pay for travel, but other costs, maybe costs around healthcare, for example. There was also a small amount of information about the impact on children. So it may be that their parents are no longer able to support them if they want to go to university. Other impacts may be that the children may have to, if they're at that age, actually start work to be able to also help contribute towards the family finances. We identified information about ways in which that people could be helped. So one was obviously things around enabling people to stay in work for longer, and this related to both the person with young onset dementia and also their supporter. The importance of people being signposted to age-appropriate financial support. The importance of other things such as advanced planning, such as people being able to do things such as thinking about power of attorney. We've looked at the research evidence, but we also wanted to look at what the other types of literature, and we refer to this as grey literature, but when I'm talking about grey literature, I'm talking about what other information is out there that may occur in websites, in leaflets, what other sources of information are out there. And we found 20 sources of information, typically leaflets. And very interesting, these were actually really, really helpful resources that gave a lot of guidance and advice for people. So the research evidence tended to focus more on what the issues were, but these other types of sources tended to focus more on actually giving people help. So guidance on maintaining and leaving employment, knowing legal rights. So these are the sorts of information that these resources have, and I'll share what they were on the next slide. But, tips about reducing costs, things about guidance around advanced care planning, encouraging people where to seek help, and guidance around, where to seek specialist advice. So this is just an example of the leaflets that we came across. So here's some examples here, and we've just given some examples here of the types of information that they contained. So one thing we learned from this was there's a lot of really helpful resources already out there, that they exist, and there's a really comprehensive information in there. But one of our reflections was perhaps around the fact that perhaps people, it's navigating, perhaps it's about finding these resources in the first place. And that relates to people living with a condition, their family supporters, but also health and social care professionals. It's maybe about knowing how to find them. We then moved on to conducting good practice interviews. So we looked at the research evidence base, we looked at the evidence base from the grey literature, but we also wanted to speak to people as well. So we spoke to professionals and we were, what is good practice in this area around supporting people around finances? What do they do? What do we know? And here's just some of we had a lot of information from this, and just some of the advice they were giving us. So, good practice around, telling people about reasonable adjustments. These are also sort of workplace issues. So, getting that occupational health, signposting people, thinking about how we could improve things, such as intervening early, raising awareness in employers. But they also identified there was good practice, but they also identified that there just are barriers, that there's a lack of specialist knowledge on this area. There's a lack of free advice when dementia is at a younger age, at this working age. The lack of resources in this area, and the fact that very often for people, particularly when you're thinking about working, that it's just easier to retire. I'm just now going to move on to some of the quotes that we had from people. These were some of the areas that they talked about in terms of good practice. So this is a professional, talking about the fact that very often for them, it's just about learning through experience. So they're talking about that over the years, they've gathered a wealth of information about the implications of certain financial situations by doing the job. So they're not somebody who's an independent financial advisor. They're not Martin Lewis, who, if you don't know, that's a person on TV who gives it financial advice. But what they've learnt over the years is they've collected some information so that they're able to advise people, to help them make decisions, just to help them out. There was also recognition about the need for continual support for people. So the awareness that things can change. So, the fact that finance needs to be reviewed regularly. So we've talked in this webinar about the fact that, you've got things such as, paying for care. The family may be coping really well to begin with, but later on they may actually need to be getting, sort of care services in. And financial circumstances can change. So it's about the need for people to get regular support. And this is the quote that I flagged up right at the very start. But it's, I think, really crucial, because what it's highlighting is the importance of the actual impact of being with somebody and having that experience, being with somebody who's either had to stop working, reduce the hours, and the impact that has on a family unit or someone living alone. Financially, how does that impact when there's mortgages involved, debts and arrears, when you've got dependents. And they're talking about all this information they've gathered from working with people. There's no amount of training that I don't think that you can prepare for the impact until you speak to someone whereby they're talking about the house being on the line, how they're going to survive. And I think this quote is really crucial to our thinking in a respect that it's about the fact of enabling people, raising awareness of the realities of the financial impact of young onset dementia. So we'd had all that information from looking at the literature, we'd done our good practice interviews. We then took this to co-production groups, because at the end of this project, we wanted to create something that would be helpful around raising awareness around the financial impact of young onset dementia. So a co-production group, this was a small group, it was a mixed group, professionals, people with young onset dementia and the supporters. And we took it to them, this is the issue. Where should we focus our energies? What should we be focusing on? Who should we be targeting in creating a resource? Who should it be targeted at? And also, what format should it be in? What should we create? So very much what we were doing was being driven by the co-production groups. We provided them with the information, but it was up to them to decide what we did. We did have some remits in the fact that we had to be realistic, because we had 3 months to do this work and we had a small pot of funds. So there was a bit of remit about what they could do, but they were very much guiding, and it was them that came up with the idea that what we needed to do was, one was to create a resource, but the other thing was to create an animation to raise awareness of the financial impact of young onset dementia. And so that's what we did. So in creating the resource, we recognise that there's a lot of really helpful information out there already, as I've highlighted in my previous slides. There's a lot of really helpful resources that have already been created. But what we try to do in this resource is to bring together where to find all that really helpful information. So we've created a short booklet that focuses on key aspects of support for people with young onset dementia and their families, about how to manage the financial impact. So it's just sort of a one-stop place of where to start to find the rest of that information. And we'll be sharing the links for this at the end of the webinar, but it's, that's what we created with this group, and they fed back on the design of it, they fed back on the content, so very much working with them. If you've been to our previous webinar, or if you've not, but to be aware that in this study, we focused on the financial impact of young onset dementia, but we also, as another piece of work, we focused on developing resources around raising social care workers' awareness of young onset dementia. So just to say that there are also resources being created on that. And here at the bottom, you can see what we've been creating. And just to flag up that the resources and publications that we've been creating are all located on the Young Dementia Network website. So that's where they're located there. So I'm going to finish the webinar off now, and we're going to share the animation that we've created around raising awareness of the financial impact of young onset dementia. So I'm going to stop sharing my screen so we can show the animation.
The financial impact of young onset dementia, where symptoms develop before the age of 65, can be devastating. When I was diagnosed with dementia in my 50s, me and my family faced huge changes. One of the most worrying was how it would impact our finances. I thought I'd have to leave my job straight away, and we'd lose my income. We still had a mortgage and bills to pay, and our children relied on us for financial support. I was terrified we might lose everything. We felt desperate and overwhelmed. Information on finances and young onset dementia does exist, but it's often hard to find. That's where social care professionals can help. We were extremely lucky to be referred to a social worker who understood the financial challenges young onset dementia can bring. She gave us clear information, advised who to speak to about different financial issues, and explained our rights at work. With adjustments, I was able to stay in my job, giving us precious time to plan for the future. Our social worker also put us in touch with our local carers centre, which helped us apply for the benefits we were entitled to, and she advised us to prepare for future costs and how we would manage financially in years to come. We were lucky, but people in our situation shouldn't have to rely on luck. Surely there must be a way of making sure everyone affected by young onset dementia has access to specialist information and advice on managing finances. Effective financial guidance from social care staff can reduce stress and financial costs to the person, their family, and services. Financial support matters. Let's make it accessible to everyone living with young onset dementia.
Thank you so much, Catherine. That was an excellent presentation. It was really so thorough, and the moving from the findings to the resources is so helpful, I think. May we have Gareth? Let's introduce Gareth and Elaine. This is your panel really for the questions. Gareth also has lived experience like Elaine cared for his wife who died last year. Whilst caring for your wife, Gareth, I know you had two sons. You have two sons, so you're parenting at the same time, which must bring particular financial issues too. I'm going to pose some questions to you in no particular order. What awareness training has been done for GPs who are core to forming an early diagnosis, which can prevent people like Elaine and Gareth going without essential finances for years? Is that one that you could respond to, Catherine, or?
Yeah, I'm happy to make a start, and then other people can step in. I think, and I don't know if there's any GPs on the call here, but I think that training can often be quite limited. I mean, I teach health and social care professionals, and I've taught cohorts of GPs before. So this is on accredited program, so this isn't part of the training that they do. But I think that one is that there's a lack of awareness around young onset dementia. I think it's increasing now in terms of their profession, but in terms of support that's provided, I think there's also a lack of awareness around the support that people need. Certainly the professionals that I've taught had a bit of an eye-opener in terms of post-diagnostic support and what actually was available.
Yeah.
I think, and it's sometimes, I think, a lack of understanding around the fact that we tend to think when people get diagnosis, they're going to have all the support they need in place. And that very often isn't happening. And I think it's also raising awareness, the lack of awareness around how difficult it can be to find services and the challenges around that. I don't know if anybody else wants to step in.
That one was particularly around trying to get an early diagnosis, so that you don't have that gap in terms of financial support. But one of the questions was around, well, how did you, Elaine and Gareth, how did you find the financial support that was available to you? Elaine?
Just by searching the internet, finding anyone that you could speak to. Again, local groups, you can start to piece things together from them. Yeah. Also, the DEEP organisation have got a very good DEEP booklet. You just find it as you go along, to be honest.
Yeah. Gareth, have you got anything to add to that?
Well, similar. I think, we're aware of the more obvious ones like, PIP and employment support allowance and stuff like that, but it's more the little tricks of the trade, I guess. It's, there's like there's grants for young carers, for example. It's like taking out life insurance policies for over 50s, that you don't normally pay out much, but you can get early payouts for them. You can get, early retirement. It was just a lot of research and speaking to people. I think one of the best bits of advice I was always given was by actually my friend whose dad died from a dementia. And she said to me, get your account separate as soon as possible, because if they ever do any financial assessments, you don't want it to be on you if you've got an income. And that's basically how I got paid for care through the social worker, through the council. And also that, bizarrely enough, because we moved house to have a bigger house to care for Sarah better, our mortgage increased, and that took us over. That made the threshold balance change, and we got paid for care. So it's counterintuitive that you to increase your mortgage, but it worked for us.
Okay, thank you. Is there any retrospective financial support if you haven't been able to achieve a formal diagnosis for an extended period of time and were unsure if the condition was temporary or permanent? So that's a little bit going back to those delayed diagnoses that people get and how it can have a financial impact. Is there any retrospective financial support?
In our situation, it was backdated to the letter of formal diagnosis. It didn't go beyond that.
Right. Okay.
Yeah. And similar, but I would say that a lot of these you don't need a formal diagnosis for, do you? I mean, there may be symptoms. So Sarah was demonstrating some material symptoms anyway, and we still got some of these benefits and so on before she actually got a formal diagnosis.
Okay, that's very useful to know. There is a question about life insurance policies, which you've touched on, Gareth. Do any of the life insurance policies offer payouts for dementia diagnoses the way they do with terminal or critical illness? Just a reminder that we're not offering formal financial advice here, but it would be really useful to understand your experience, if either of you have.
Yeah, I can go if you want. So we had critical illness cover, which paid out, on diagnosis. So that was helpful. We had I had a former life insurance policy which had had in place before she was ill, and then, like I say, what I was doing was every 3 months I was taking out another over 50s policy, and because they compare anywhere between like 6,000 up to 30,000, and you don't need to have a medical diagnosis for them. Now, the issue with those is obviously if you make more than about 13 years worth of payments, then you're paid into it more than you're ever going to get out of it. But because Sarah had frontotemporal dementia, which was, tends to have a shorter lifespan, and she was diagnosed with motor neuron disease for the last year of her life as well. That for my situation, it was highly relevant. And yeah, in the end, I had about 6 policies in place for which paid out, because there's like a qualifying period of time basically, which was 12 months. So yeah, we had quite a few in place.
Thank you, guys. That's a consideration. Elaine, have you got any thoughts on that?
Nothing on insurance policies. No, it wasn't something I really thought of.
No, okay. Another question, was it a lengthy process waiting for the financial benefits that you were entitled to be given?
It was, but they did backdate it, like I say, to the letter. So
to the date of the letter
of diagnosis.
Diagnosis, yeah. Gareth, have you got anything?
Yes, similar. Certainly from the government perspective and pension perspective, they did take time. Some of the other ones were relatively quick. So we tapped into quite a few different grants that were available from things like the Bankworks charity to the M&D Association to Sheffield Young Carers. There's just lots of bits and bobs around. And also, I know this is not a question that was asked, but somebody was talking about respite, and there's some really good organisations like the Family Holiday Association, like Carefree Space, like after Umbridge, that offer free stays for carers to get respite, and they don't always need a diagnosis either.
Yes, the question about respite in particular was focusing in on enabling the carer to work for longer, and whether there was any research around that. Are you aware of any, Catherine?
Yeah, so it did come up as one of the solutions. It came up in there around the fact of the importance of flexible. It came up alongside things such as flexible working to enable carers to work longer, so the fact that they could take time off to go to appointments, but it also came up around the fact that the need for support for carers. So that could be around, sort of paid support, but also things such as respite, but very much embedded in the need for flexible working arrangements for carers to enable them to continue working.
Thank you. Has there been any discussions with the Department of Work and Pensions around entitlement to claim the state pension earlier after receiving a young onset diagnosis? Does anyone have any information on that?
No. That's really interesting, because it's something that I'm finding at the moment as these caring costs are starting to really accumulate. Lawrence won't get his state pension for another 2.5 years, because that age has increased. You're not going to get your state pension until you're 67, sometimes 68, and that makes a big difference financially.
Yes, yes. So we're not aware of any discussions.
A good question.
Yes, it's a very good question, and a lot to do with the pensions, about pushing them back in terms of age, not bringing it forward. Are there any strengths, resiliences, top tips that Elaine or Gareth are happy to share with the attendees?
Keep your sense of humour. It's definitely one of them.
Yeah. And also, I think just you learn not to get bothered by the small stuff. The stuff you used to get bothered by just doesn't matter anymore, does it? And I think ultimately all I ever tried to do with Sarah was just make sure she was happy and safe, basically. That's what it boiled down to.
Yeah, totally agree. Safe and comfortable.
Yep. one last question, if I can find it. What was the most useful source of information regarding young onset dementia and finances? The most useful? Just one. Or not one?
Probably speaking to other people is you learn a lot just from other people, and maybe that doesn't apply to you, but it sends you off on a journey to find out what they were talking about, and you might stumble across something else.
Yeah.
Yeah.
Anything, Gareth, you want to add to that?
Mine was just a mixture: research, other people, Dementia UK, Age UK. Just picking bits up as you go along, really.
Thank you. Anything you want to add, Catherine, before we close?
No, but I guess hopefully that the resource that we've created is going to be useful for people in the terms of the fact that what it does is try and bring a lot of information together in one place. So hopefully that is a useful starting point for people trying to navigate what sort of help and support is available.
Yeah, should be really good.
You mind if I add something, Tess, if that's all right?
Sure.
So I think other things to be aware of for people is, like, we applied for carers allowance, but because we were already getting other benefits, we made sure the carers allowance was in my son's name, because he wasn't working at the time, and he was helping support, little tricks like that. There's, for people with young onset, because their partner's likely still to be working, there's bereavement support allowance for afterwards, which pays out up to around about £10,000 in total, for example. And it's other things as well, like, you're entitled to paid home adaptations through the council, as long as, I can't remember if it's like savings or income threshold as well. And one of the things I read when I first looked into it is like 85% of people who've got young onset dementia end up in a care home at some point, and 50% of their partners have to give up work, which just shows you the impact. One thing for people on the course as well is, I wrote a blog about my experiences as we went through this journey. It's on Facebook, called Dementia of an M&D Dad. So please, it shows the whole journey, not just what I can talk about in 10 minutes, basically. So feel free to look at it.
Yeah. Thank you so much. Thank you, Gareth and Elaine, for your contributions. And thank you very much, Catherine, for presenting the information so well to us. I'm going to close now. We will add the link to the blog, I hope, on the follow-up email, which will have the presentation and the recording and as much useful information as we can possibly offer you. And of course, the link to the resource. Our next webinar date is not until Wednesday, the 25th of February, so we'll be taking a break. And then we'll be looking at young onset dementia support and care, and taking it beyond the concept of age appropriate, looking at that. So registration for that webinar will be in the follow-up email to this webinar, which you'll get in a few days' time. So other than that, thank you so much to everyone for attending, and thank you for contributing, Catherine, Gareth and Elaine. Thank you very much.
Thank you.
Thank you.